Today we research everything in our lives, right? From vacations to cars, home loans, electronics, even appliances. But what about the most important investment we make for ourselves, our family, and our employees? Healthcare. It's been said that if you don't have your health, you don't have anything. At Desert Oasis Health Care, the team believes that's true, and they're providing you now the insight you need to make the most informed decisions possible regarding high-quality care and wellness. Welcome to The Pulse. Have you ever heard the phrase, your health, your life, our passion? At Desert Oasis Healthcare, or DOHC, as many of its members know it as, that phrase is more than just a tagline. It is the mission and the commitment that was made when they opened back in 1981 as one of the first medical groups in Southern California. Here we are now 40 years later with a network that includes all local hospitals. DOHC is a physician-owned and led medical group serving the Coachella Valley and the high desert communities of the Greater Morongo Basin. DOHC membership is primarily composed of seniors on Medicare, as well as working people and their dependents, covered by employer group health plans. I'm Bianca Rae, and I'll be your host on this journey. For the next 30 minutes, we're going to take a deep dive, exploring who exactly Desert Oasis Health Care is, as we take a tour of their services and dive into questions like, what exactly is an HMO? What's the best Medicare plan? And what departments handle which questions? Along the way, we hope you learn some of what you can expect as a member, like having access, for example, to an entire patient care team devoted to your care. A team that begins with your primary care physician, or PCP, and continues with nurses, pharmacists, mental health practitioners, nutritionists, case managers, and many others. Today, we're at the main campus of DOHC here in beautiful Palm Springs. It's located right across the street from Palm Springs International Airport and then right behind Palm Springs City Hall. So this is essentially the main hub of DOHC, right? It's where most of the leadership team is located, as well as one of the 4 immediate care clinics. To get a greater understanding of what's happening here, as well as across the entire DOHC network, let's check in with Dr. Brian Hodgkins. He is the Vice President of Clinical Operations at Desert Oasis Health Care. I'm here with Brian Hodgkins, the VP of Clinical Operations for Desert Oasis Healthcare. Brian, I'm so excited to get to talk to you about this. And for people at home, just to learn more about DOHC, learning that this was one of the first medical groups created ever in these Southern California desert communities. I just want to start with the mission behind it. Why was DOHC created in the first place?
Well, I'm not sure it was much created as it just came into being with a need that I think over the years has grown to be now just part of the community. We started over 42 years ago as a small mom and pop medical group in practice on the corner of Sunrise and Visagino. And we still have the pictures of that little storefront. And over the last 40 years, through hard work, effort, dedication to the community, and really a dedication to providing better healthcare locally, we've grown from that mom and pop practice to actually care for over 60,000 of our community members and neighbors. So it's been quite a growth.
And community members spanning various regions, not just the Coachella Valley, but communities in San Bernardino and Riverside County. What makes DOHC different than other healthcare providers?
I think we're uniquely different both in our approach to healthcare and I think our dedication to community. We do have patients all the way up from 29 Palms, Yucca Valley, all the way to the East Valley from Coachella. And we geographically and strategically plan and dispense our resources and providers to be able to address in ease and getting patients in to see their doctor. And I think our commitment to that, also just being care is provided locally, and I think that's a critical thing that most people overlook. We're physician-led, physician-owned and driven, but we really have, I would say, a mission-led organization. From every employee that works here is committed really to, I would say, excellence in every single encounter.
You know, something I experienced, I'm a 34-year-old educated woman, feel as an informed person. I have 65-year-old parents, and yet managing their healthcare, mine, it seems so intimidating, sometimes so confusing. And what I love about DOHC, you're kind of explaining that to me that this could be your medical care all under one roof, and you make it easy to choose doctors. Can you kind of explain how somebody becomes a member and who's eligible. It's open to everyone, yes?
Absolutely. And you know what's interesting? Patients call me all the time and tell me, Brian, it's so hard, not just to get a doctor, but to navigate the complexity of the modern healthcare system. And we've always wanted to simplify it. So just make it easy, put you with the primary care physician, and then we unwrap an entire team around that primary care physician so that they just have to see the patients they need to see. And we do a lot of the care behind the scenes in organizing and strategizing what that patient needs from diagnostics. So the radiology, if they need lab work, we take care of all that behind the scenes and just keep it very simple.
I love that. And I know a big part of DOHC's mission is preventative care, right? Can you explain how you focus on that?
Yeah, you know, we spend so much money in, I would say, care dollars. We try to think now in terms of cure dollars, meaning if we can keep you well before you get hospitalized, before the diabetic has a kidney issue or loses sight, we focus a lot of our programs right now at keeping patients well. We have annual wellness visits. We do all these health and wellness programs to keep people from falling, to keep people from progressing down into what we call into the, we call it the sick bucket. We don't want you ever there. Nothing good happens in a hospital usually. And if we can keep you from having another hospital meal, you or your family members, we feel we're doing something right. We want to keep care in the primary care office, out of expensive places that are complex, which normally means we didn't do our job in the first place. A hospitalization we look at as a failure. So we want to keep people, if you're going to go to the hospital, have a baby.
The fact that you want to keep people from even getting to that point and focus on preventative care, I think is extremely reassuring and just nice to hear, something that you don't hear a lot.
Well, we joke about it internally. It's not really a tagline, but it is your health. Yeah. It's your life. That truly is our passion. Yeah. We want to be a place where, when we were talking about senior care and you were talking about your mom and dad, being 65, we want to be the place where you feel comfortable sending your mom or your dad for care. We want to be that resource, and we feel comfortable that we are really delivering on that promise.
Brian, I know you have 60,000 members currently, and it's open to many other people, obviously, throughout Southern California. Any final thoughts, final words you want to share?
Well, we know that healthcare can be complex, and I hear it every day, and I see it every day, and it's very unfortunate. But we want to try to keep it simple. We want to distill it down so that a patient just needs to get in front of their doctor, and then we'll do the rest with them as a team effort. So when you think about Desert Oasis, we want to bring everyone under just one roof of care, one center of care, and then also an oasis of care.
It's incredible to see a medical group that's been here in Southern California for so long, working hard to keep all of your medical care under one roof and in one family. Call Desert Oasis Health Care or go to mydohc.com. Turning now to a very important segment, you're about to hear an extremely powerful testimonial from somebody who's served by Desert Oasis Health Care. Many of you, I'm sure, recognize this woman. She's born here in the Coachella Valley, been a broadcast journalist for more than 50 years. Patan, thank you for being here. I know we're about to get personal, so thank you for sharing your story.
Well, personal involves a lot of mental health.
Yes.
And I'm going to talk a lot about that.
Thank you for being here and doing that.
You're entirely welcome. You see, as you age, you need help. And I didn't realize it, that I had some warning signs that were coming up. But for the most part, I got Desert Oasis Health Care, and I got it the minute I turned 65. Mm-hmm. The problem is I didn't know what I had. I had no idea how the depth of Desert Oasis Health Care, how big they are, but being big, they're also so personal. I mean, they're run by doctors. The company is owned by a doctor. It's a huge, big company, but it's very small and very personal when it comes down to one-on-one with you, because they have done nothing but absolutely treat me phenomenally well. And anybody I have ever talked to about their experience here at Desert Oasis Health Care, it's hands down the best they've ever had.
How has DOHC made you feel seen and heard, not only as a senior, as a member, as a person here in the desert?
When I need something, they have it. When I needed a special doctor for my mental health, they got one. I came to realize that the older you get, the harder it is to realize you're getting old. And it's not a lot of fun if you have issues. And back in 2014, a situation came about where there was something growing in my right kidney. My right kidney had to come out. If it didn't come out, I was going to die. And Desert Oasis moved mountains to get that done. And it was perfect. I mean, I'm alive today because they did it right.
Incredible.
And 3 years ago, I started having, for the first time since I was diagnosed with clinical manic depression, I had a panic attack. Wow. And I ignored it. I didn't think there was anything wrong with me. I'd been on the same medication for 28 years. I was fine. Well, I wasn't fine. And Desert Oasis reached out and found me a superb psychopharmacologist, psychiatrist. And I realized what great care I had. I mean, everything I needed, Desert Oasis Health Care saw to it I got. And what I also found out is that, in case you haven't noticed, this attack that I had in the hospital, it affected my voice. And I couldn't figure out why. So another phone call to Desert Oasis. And I said, look, I've got a problem. My vocal cord, my right vocal cord, well, after so many years in broadcasting, it got old. How would you like, oh, come on, Bianca, come on. I can't have a vocal cord. I'm a broadcast journalist.
That's your bread and butter.
Yeah, I said, what do we do about my voice?
Oh, gosh.
And he said, there's only one place in the state that you can go, and that's the University of California at San Diego. And I thought immediately, there goes my insurance out the window.
Sure.
Wrong.
Wow.
Desert Oasis Health Care covers me at San Diego University.
What I'm hearing you say is that Desert Oasis Health Care has truly been, would you call it a partner, along with you the entire way as you've watched your mental health progress and maybe worse and get better. This entire time they've been there along with you.
There isn't anything Desert Oasis Health Care didn't have that I didn't need, including something for my voice. They're not a corporation in it to make just the money from healthcare. They're a corporation that's in it for just the healthcare. And the next time we talk, I will have had my voice with a shot in it, and it'll come back. And I will hopefully be normal again, and we can have another conversation.
Well, I look forward to that. And thank you for sharing your story and just being so open and honest with everybody at home.
Patty's testimonial is just one of many of members feeling seen and heard and understood after joining the DOHC family. Call Desert Oasis Healthcare or go to mydohc.com.
Joining us now is Christine Tickman, Director of Immediate Care here at Desert Oasis Healthcare. Good to see you. And this is an important topic because a lot of people, I think, have questions about immediate care, what warrants a visit there versus a doctor or the ER. And we were just talking about this. Envision like a big spectrum, right? On one end, you have doctors. It's important, but you could wait a few days or a week to see your doctor. The other end is the ER. It's urgent. You got to get in there right now. It's life-threatening.
Yeah.
And then the middle is what we say, everything else, basically, right?
It's the middle ground.
The middle ground.
And I think there's a lot of question behind that topic. Our Desert Oasis Immediate Cares, we have the opportunity and the knowledge to treat a vast majority of disease processes. So anything that you would see typical in an urgent care setting, especially now as we're going into the respiratory season, right? The flus, the streps, you know, the unfortunate COVID that we still have lingering upon us. Those are kind of things that you're going to see pretty much routinely in the urgent care. But there are some definite life-threatening situations where we don't want to delay the care, and those really require acute hospitalization. So those are going to be things that might be considered a traumatic fall, for instance, from a ladder, and you're concerned about maybe some cervical or spinal injury. Those are things you don't want to wait on. Things like a stroke, things like a heart attack. You know, those are things that, again, we want you to be in the place that you need to be so that you're getting the type of care that you need and that there's not a delay in the care that you need. But
and that warrants that ER visit.
That warrants that emergency room visit. Again, we don't want to delay the care that you need. It's life-threatening. There is a sense of urgency there, and you definitely need to be hospitalized or at least evaluated and seen by a team that can really intervene based on your life-threatening symptoms. But here at Desert Oasis Immediate Care, again, we have the opportunity to see a vast majority of disease processes, and that can be anywhere between the normal cold, cough, flu, urinary tract infections. We do laceration repairs, wound evaluation, splinting for some fractures, and even some of those maybe chronic established cardiac conditions. Again, if it's not life-threatening, then we would love to encourage you to come into our Desert Oasis Immediate Cares. But if it's life-threatening, definitely that if the hospital's where you need to be, then that's what we would endorse.
What makes Desert Oasis Healthcare's immediate care system unique?
So this is actually something that I'm passionate about. Desert Oasis, I think, as an organization, we really have the opportunity to connect patients and we meet them at their level. So as an organization, we're always looking for ways to improve, and we're always looking for ways to provide the best continuity of care. Our organization has resources at our fingertips, and our immediate care staff is trained to know these resources. So if we can get you to a program or a specialist without delaying that and making sure that there's continuity, we really like to help our patients navigate through the healthcare system, because that in itself can be very confusing, right? I have to go see who, and I got to go where, and where am I supposed to call, and what am I waiting on, and where's the imaging center, and what labs am I supposed to draw? I mean, it really can be very overwhelming for the patients. So as an organization, I think we're special because our immediate care will see our Desert Oasis patients, and we'll also make sure that they're connected to the programs that they need to be connected to ensure that we're really meeting them at their level and we're giving them the best healthcare quality that we can give them.
And I think too, if you still have that confusion of, am I being too dramatic by going to immediate care? It's better to go and be proactive about your health.
Absolutely.
And maybe they'll say, hey, you're okay, you can wait a week for your doctor, but better to be told that than think it wasn't important enough to go. Just, you can go.
Absolutely.
Yes.
We would prefer you come in and see us and let us determine if we can meet your needs versus not at all. Yeah.
Perfect. Thank you so much.
Oh, such a pleasure.
Thanks. You too. There's 4 different immediate care locations throughout the desert, including Yucca Valley, so whenever you need help, it's never far away. Call Desert Oasis Health Care or go to mydohc.com. Joining us now is Leah Dixon, Director of Outreach and Priority Care here at Desert Oasis Health Care. Thanks for being here. It's an important conversation because we want people to truly understand all the facets, all the different aspects of DOHC, and one of those, of course, their programs, the Wellness Clinic. Let's just start by explaining what exactly is the Wellness Clinic.
So the Wellness Clinic is it's a service that we offer to our Medicare Advantage senior patients. It's a once-a-year annual health review. Patients come to the office. The visit is a total of 1 hour. The first 30 minutes is spent with the medical assistant, where the medical assistant will do an EKG, which is an electrocardiogram. This looks at the heart. They'll check the circulation with using a little finger device, a pulse oximeter device. They'll do some screening tests, ask about memory, depression, things like that. Ideally, the patient has had their labs done a week before the visit. Then the second part of the visit, the second 30 minutes is spent with a provider. This is going to be a nurse practitioner or a PA, where they spend time going over the results of those first 30 minutes and the blood work. And they will also spend a lot of time educating the patient about their chronic illnesses, answering any questions. And of course, you mentioned programs at Desert Oasis. You know, we have a lot of programs here at Desert Oasis Healthcare. So one of the things that's important to us is also what we call plugging them in to our different programs. So just to give you an example, a person who has uncontrolled diabetes, we will get that person connected with what we call our MMDM program. Someone who has COPD, we will put them in what we call our MMPalm program.
So explain how a visit to the Wellness Clinic is different than just your annual checkup with your primary care physician.
So one of the biggest things is time. You know, we've dedicated a full hour for this visit with these patients to see this provider. The other thing, again, is going back to just like the education piece. I mean, I've worked in this wellness clinic for well over 10 years, and the feedback that you get invariably across the board is no one has ever really taken the time to explain this quite like this to me, you know, so they're very grateful once they get into our clinics for the time that we spend just educating them, meeting them where they're at on their level, and just explaining any disease processes to them.
I'd have to imagine in your more than a decade of working here at DOHC, specifically with the Wellness Clinic, you've heard many stories of people's lives being effectively changed by just going to one wellness clinic appointment, yes?
There's several, but the one that comes to my mind that always sticks out was the story about the man who did not want to have his colonoscopy. You know, patients are always hesitant to do colonoscopies. Well, not always, but hesitant for one reason or another. I talked to this gentleman. I said, it's really time for you to get this done. He did it. The following year when he came to see me, he said, you know, I had colon cancer and I didn't know it, but the colonoscopy picked up on it. They were able to surgically resect anything that was there, and he said he was fine. So he was very grateful. And he came, and as far as I know, continues to come year over year to these visits.
I love that. So explain again, who is eligible, and is there a cost for the Wellness Clinic?
There's no cost for our members, and this is exclusively for our DOHC Medicare Advantage senior patients.
Okay, so nice, so important. Thank you for explaining this. And again, there's just so many resources that I'm learning that come with being a member of Desert Oasis Healthcare. So it's nice to learn about one more of them.
Well, thank you. It's my pleasure.
Thank you.
So think of the Wellness Clinic as this extra layer of protection and care for you and your health. To become a member, call Desert Oasis Health Care or go to mydohc.com.
We're here now with Ronviramontes. He is the manager of the customer service department here at Desert Oasis Health Care. Ron, I'm so glad to talk to you because this is important. Customer service is truly the connector between all of you at home and the medical group here. It can make or break somebody's experience, right? So let's just start with the school of thought behind DOHC's customer service.
Customer service basically is an information and advocacy department for Desert Oasis Health Care. Members seeking information about their healthcare, about their medical group, about our provider network will call into customer service. Our team also serves as advocates for our members to ensure that they have access to the providers and the healthcare that they need.
So how does somebody know if it's time to call their doctor and ask them a question or maybe just call customer service?
They can do either. If it's a medical question and they're not sure where to go for information, we can help direct them. A lot of the questions that members may have can be answered either in customer service or within one of the departments in Desert Oasis Healthcare. So my team and I are trained in knowing where to be able to direct those people to be able to get the information they need and the care that they need.
Something that I've experienced in my life, not here, elsewhere, and I'm sure people at home can experience that, feel this frustration when you want to call customer service and you can't get a human on the phone and you have a really important question to ask about yourself and your family, and it's just automated. And I know you guys really strive to make sure there's a human there for people to answer their questions.
Absolutely, absolutely. Our phones are manned 8 to 5, Monday through Friday. We don't even close for lunch. So we have somebody who is available to answer phones all the time. As with any organization, we're going to have peak call volume time. So waits may be a little bit longer, but you will end up being directed to a live person to be able to respond to your inquiries.
And I know digital, some people prefer emailing, but there's also a lot of people that still feel most comfortable calling, and that is still a big part of what you do, but you are bringing in email as well. Explain a little bit about the balance between both, what you're seeing here.
We're starting to see, as people become a little bit more comfortable with technology and getting answers to information on their time, not on our time. So after work, we'll have some of our members are sending emails to us. They may be texting us and asking for information. So that aspect of being able to have bidirectional communication between our members in Desert Oasis is receiving a lot more focus here at Desert Oasis.
You guys seem to have a lot of patience for when people call, and that is arguably the most critical aspect of a customer service department.
Absolutely. Every one of us, we're not only employees of Desert Oasis Healthcare, we're also patients within Desert Oasis Healthcare. We all have parents, we all have relatives that we would want to advocate, whether it be with Desert Oasis or another medical group. How do we want that service to be provided to a relative, to a friend? And that's how we approach our jobs here.
Ron, thank you for explaining all of this and just being so compassionate. You can really feel that through everything you do and everything you're explaining. Thank you so much.
Thank you.
It's important that somebody not only understands you, but also is patient with you, right? As you're trying to navigate your health care. Whatever the question, customer service can answer it. Call Desert Oasis Healthcare or go to mydohc.com.
Joining us now is Jessica Voigt, the Director of Nursing. Jessica, it's so good to be with you. And this is an important topic. This is a very important decision. Your primary care physician, I asked her, I said, what would you call your PCP, the head of the pyramid? And you said you call it the
captain of the ship.
Captain of the ship.
Yeah, absolutely. I think that your relationship that you have with your physician is much like one you'd want to have with the captain of the ship, right? Making sure that they are steering you down smooth waters and really getting you to your destination and where you want to be in life. And I think that that's what's great about primary care providers, is that they really are the one that's going to help you steer that ship in the right direction.
A good leader, right, in your life.
Absolutely.
For those who maybe don't have a primary care physician or PCP, as you'll hear us throughout the interview saying, or maybe they've, bounced around throughout their life, let's just start with the basics of what is a good ideal relationship to have with your primary care physician, and what role should they play in your life?
Sure. So, for me, when I'm searching for a good primary care physician, I really want to make sure that I have somebody who's qualified, right? Mm-hmm. And the best news is that Desert Oasis does that for you. I mean, we seek out the most qualified primary care providers, ones that have good quality outcomes, ones that are really well-versed and up-to-date with the best treatment options, with the best care, and ones who really want to see their patients kind of become family, right? And also patients that they want to keep healthy. We want longevity, and we really want our PCPs to be focused on keeping our patients healthy.
You mentioned choosing one that's qualified, and you said DOHC, of course, all of them are qualified. So I'm going to challenge you. If I'm here trying to find a new PCP, it's overwhelming, right? There's so many options when you know they're all so great. So how do you narrow it down?
Well, I think that you have a lot of options where you can go. You can decide about their training background. It really gives us that opportunity to diversify what you have there. So I think it's really important to dive in and really ask yourself those questions. Are you looking for somebody with kind of a holistic background? Are you looking for somebody who really wants to focus on you as the entire universe, right? So your diet, your exercise, and really looking at things from that perspective. Or do you really just need to come in and come out, right? And there are some of those providers that are definitely here to give you those straight answers, get to the bottom of it, because we all are busy in life as well.
Yeah, so those are the hard skills to look for, right? Maybe if you're particular about some, but there are soft skills. We were just talking about this. Like for me, for example, I'm a sensitive person.
For sure.
I need somebody who, you know, delivers a message gently and softly. And some people are just curt and, you know, to the point. And some people like that. They don't need flowery language at the doctor's office.
That's how I
do. I need it, you know, sweetened a little bit. So that's like a whole part of this. You do need to choose someone that you personally click with, right?
Absolutely. And I think the nice thing is that, you know, we're always welcoming for you to come in and have a conversation with the provider, even to like try them out almost as like an interview perspective and really find that relationship. And we have such a broad network that we can meet you at any point.
Love that. And specialists are very important, yes? And explain the process of your PCP referring you essentially to a specialist that you need.
Yeah,
How does that
absolutely.
work?
So at Desert Oasis Health Care, we really have a broad net. And our network is really seeking to find the best specialists with good access. And they work really closely together with the primary care providers. So one thing that's a benefit at Desert Oasis is we employ some of our specialists. So your primary care provider can literally pick up the phone immediately and talk to the specialist about your case and get you in and coordinate that care. And once again, bringing us back to the primary care, being the captain of the ship and speaking directly with the specialist, which is so unique in this kind of time that we have where specialists are spread so thin. This really gives us the opportunity to tap in and be able to provide that care fluidly. We have a wonderful department that really works with membership and works specifically with our patients to find the best fit. So I think we can absolutely help facilitate that.
Well, thank you so much for explaining.
Yeah.
Thank you.
Now, this is just an introduction to some of what you'll find at the Palm Springs headquarters of Desert Oasis Health Care. But we are just getting started. In upcoming episodes of The Pulse, we'll be taking you to some of the many other locations throughout the Coachella Valley and the surrounding high desert communities. We hope we've sparked your curiosity to learn a bit more about what DOHC can do for you. We do want to thank Patty for her testimonial, but please know that it is just one among the 30,000 senior members that DOHC serves. We'd love, of course, to hear from each and every one of the members out there, both seniors and the 30,000 other members that DOHC serves through employer group health plans. We invite you to explore the wealth of care and knowledge DOHC has to offer by visiting the website. It's mydohc.com. Tune in next time as we show you more of what DOHC can do for you, bringing you the insights and stories that empower you to make the best choices for your health. Stay tuned for more episodes as we continue to show you the reasons why DOHC says your health, your life, our passion.